Surgery by candlelight in the year of our Lord 2025? Yeah, that's still a thing. But solar energy is making it less of a thing. Welcome to the Goodish news channel. I'm Ashley, your professional pessimist. In an effort to be more optimistic, I'm only bringing you news stories that aren't terrible. If you're looking for doom and gloom, you won't find that here, because I'm trying really hard to internally suppress all that. Some might seep out from time to time though. Sorry. Quick trivia question. What's the most populated country in the world? As of 2023, it's India. They surpassed China as the most populous country in the world. If you did guess China, don't feel bad. I thought the same thing until I worked on this story. Broadening my own horizons. Almost 1.5 billion people live in India. That means that the country is home to 1/6 of the entire world's population. It's also a high population density with 1,275 people per square mile. Compare that to the United States at 94.83 people per mile. That means that India has a population density that is more than 12 times higher than the United States. About 65% of the population living in rural areas. Rural.
Oh, this isn't for TGS. It's for my movie. The Verger has a limited release next week.
Oh, congratulations. I didn't know they had a release date for for that movie.
The Indian healthcare system, like most countries, is a frustrating one. Public healthcare in India is supposed to provide some free services and affordable options, but government funding is lacking. Not to mention that the healthcare system is significantly understaffed. There are private healthcare options, but those are often too expensive for many citizens. Public healthcare buildings are awfully poorly maintained. Medical equipment is hard to find, and access to advanced services is sometimes non-existent. All of those hurdles make providing even basic healthcare a challenge. The lack of adequate infrastructure makes everything that much more difficult. Most rural health facilities don't have clean water or consistent power. The Yelhari Primary Health Center is just one clinic that suffered from an erratic electricity supply. If the electricity in the city went out, their backup power would run out in a matter of hours. Medical operations were performed by flashlight or even candlelight. Baby warmers were non-functional, and essential medicines and vaccines were not adequately refrigerated. And unfortunately, this isn't an isolated occurrence. Yelhari is just one of 12,000 health facilities in the state of Karnataka. Karnataka covers an area of 74,000 square miles. But thanks to the SELCO Foundation, they've provided 8,000 health centers across India with power. Solar power. The hope is to reach 10,000 centers by the end of 2025 and 25,000 by 2027. 3.5 years ago, a solar energy system was placed in the Yelhari clinic. Staff no longer have to worry if they'll have adequate lighting or proper refrigeration. Most health centers across India face similar challenges. In some areas, natural disasters like cyclones can knock out power lines, and clinics can go without power for an indefinite amount of time. The lack of power in these areas can prevent patients from receiving proper care. In Chhattisgarh, where nearly all primary health centers were solar powered as of 2023, there's been an increased footfall of patients, and staff was retained due to better facilities. From 1 in 3 primary health centers lacking power in 2006, nearly all of Chhattisgarh's 800 primary health centers were solar powered by 2023. There are plans to extend solar power to approximately 5,000 sub-health centers. Healthcare isn't the only sector to reap the benefits of solar power. The SELCO Foundation has provided many tradespeople with access to reliable energy as well. The link between accessible energy and income level is indisputable. For instance, let's say there's a woman named Samira, and she works as a tailor in a village that does not have access to reliable electricity. She uses a manual sewing machine, works only during daylight hours, and she can sew just a few items per day. When customers ask for repairs or custom orders, she sometimes has to turn them away because she can't keep up. Her income is enough to cover rent and food, and there's little left for emergencies or investing in her business. Her children don't go to school because she needs their help to keep their household above water. Now imagine she has electricity. Samira can use an electric sewing machine which doubles or triples her output. She can work in the early morning or at night thanks to lights. She can create a more consistent and quality product now that she has access to better equipment. She can use a fan to keep her cool while she's working. She has more time to take in special orders. Eventually, she has enough income and demand that she can hire employees, increasing output even further. She can afford to send her children to school, which will open up more opportunities for them in their future careers. You see what I mean? Electricity is more than just flipping on a light switch. Thanks to organizations like the SELCO Foundation, more Indian citizens are being lifted out of poverty and their lives are improving. By the way, I have no affiliation with the foundation. I just think that what they're doing is really cool. Access to reliable healthcare is literally saving lives and helping to retain medical staff that the country desperately needs. The SELCO Foundation receives grants from organizations like the Waverly Street Foundation and the IKEA Foundation. So the next time you're putting together your IKEA Storklinta, you can feel good knowing you're helping to keep insulin properly cooled and babies properly warmed. If you're looking for more good news in your life, I have another video out today where I discuss the boom in solar electricity production over just the last few years. And if that wasn't enough, I have another video on how Amsterdam is saving cats from drowning with little tiny staircases. You don't want to miss it, trust me. Also, if you enjoyed this video, please give it a like and consider subscribing so we can ignore all the bad news together.